Good morning, everybody. Welcome to Patient Playbook. Today I have a special guest, our PA, Emily.
Hi, everyone.
Dr. David Feldmar.
Hi.
Today we're going to talk about surgical versus non-surgical and how each of them can marry each other. So we're talking about what topics to talk about today, and because everyone that knows me knows I love reality shows, there's this new reality show out called Age of Attraction. So the premise of the show is people dating, but you can disclose all the information but not the age. And then it had me thinking, why do some of these females literally look 20 years younger than their age, and the guys don't know that? And then vice versa, why are there some girls that are 22 that look 32? So I was thinking, do you think it's just genetics? Do you think it's maintenance? Do you think that, is there, what age should someone start to do something so they don't look their age? Emily, you can go first.
I think that's a great question. I do think some of it has to do with genetics, but I also think people are becoming really good at knowing what regimens to do, whether it's skincare regimens or Botox and fillers, keeping up to date with that, but also doing skincare treatments, so microneedling and biostimulators, all of that. I think it's a combination of everything, but I also think it's good lighting and makeup as well. So I think, good combo between that.
And what do you think, doctor?
Yeah, I definitely agree that, it's Hollywood and they do their best to make them look as good as possible, but I also think that women are just still farther on the sort of cutting edge of taking care of themselves. Men tend to be a little bit less aggressive about it and proactive about it, whereas women, in my experience, are really aware of what they need to do to keep themselves looking young for as long as possible.
A question I get asked frequently is, if I start too young, will I look fake? How do you determine, Dr. Feldmar, if someone's ready for surgery, or if you're going to pass this patient just to Emily to do microneedling or do lasers, or how are you balancing that?
Well, I think that's a sort of a multifactorial answer.
Okay. I'm ready for all the answers.
It depends on where they are individually. I don't really think that there's an age where you have to wait to start taking care of yourself. I think that what's more important is having someone that can advise you and guide you through the process and sort of have like an overall global plan for lifelong maintenance, so you could start conservatively and maintain that and grow with it, so you're not sort of accelerating too quickly in the aesthetic space, and kind of march along at an appropriate rate.
Yeah, I definitely don't think there is an age to it. I think someone can be so happy at 70 doing nothing, and someone at like 30 wants Botox just to fix their glabella lines and all of that. So I think it really is on how you feel, more so than, in a specific age.
Is it a case-by-case situation because like we said, everyone's starting maintenance and starting everything at a very young age. I didn't start Botox till I was 36. I didn't do fillers till I was 42. We have, 18-year-olds that call all the time. Do you think that their face, if they start that young, will look not natural if they're starting with Botox and fillers at a young age?
I wouldn't say so. I think there's a lot of twin studies out there that show one twin not doing anything at all, and then another doing Botox only for the next 20 years. They come back and they take photos. And it's not that the patient doesn't look 20 years older, it's that she looks like she aged gracefully, and she looks her age, but she looks beautiful. Not to say the other one doesn't, but you can tell that she's aged a little bit more than her twin. So I think...
You think it's more preventative and not?
Yeah, totally.
Okay.
And I don't think you're gonna look unnatural 20 years ahead of time.
I also think it's not just, you got to remember, it's not just sort of the advances that we've had in aesthetic surgery, aesthetic procedures that, just generally. I think a lot of the reasons why people are looking so much younger is just an overall better understanding of nutrition, diet, and how to sort of move through the world in a better way, that we're not getting the same amount of aging that our parents and grandparents did. I mean, if you just look at TV shows from 20, 30 years ago and you look at the people that are, 50 then versus 50 now, I mean, it's a world of difference.
Right.
It's a world of difference.
I'm
Like the
51
Golden
and I love
Girls.
30. Like the Golden Girls, right.
Because they were just like, I think 50.
Yeah,
maybe.
most of them were in their 50s, which is pretty
And
much
they
my
looked-
age now. And I like to think I do not look like them.
Yeah.
Some of them were in their 40s too, yes.
Yes.
It's wild, wild. So if I'm a female or a male in my 30s or 40s and I just started to get interested in aesthetics, how do I determine if I'm going to see you, Emily, which we should talk about for a second, what you specialize in?
I think if you're trying to tackle fine lines and wrinkles and volume loss in like a moderate volume loss, I think I can definitely help with that with Botox and fillers. But if it's something more like lifting and tightening, I think that's more his expertise. There are things I can do with lasers, but to have a amazing result, I think I would send him over.
Come over to the surgical
Yeah.
side.
Come over to the surgeries, send him over to the other side. Crossover. What would determine if I needed a skin tightening laser versus surgery to get rid of the skin? How do you determine that?
Well, I think that it really depends on the degree of skin damage, facial aging, facial fat loss, bone reabsorption. As we age, the anatomy of our body changes. So there comes a point where the non-surgical aesthetic treatments are really just not going to reach the kind of goals that you're looking for, and that's where surgery really does come in. I think the more interesting thing is sort of like the duality between what you're doing in aesthetics and what I'm doing in surgery. You're using fillers and other products to kind of reverse the clock and improve volume and lift and all these kind of things, whereas I'm using surgery. But there is a point where too much filler, too much volume could become detrimental to what I'm trying to do. So I think,
How so?
Well, just adding this volume, sometimes these products are permanent and we could result in some scar tissue in there, some fibrosis, granulomas, things that might get in the way during the actual surgical procedure. So I think that when you're looking at sort of like the overall global maintenance, you got to keep this in mind. We are going to be obviously getting older, and at some point surgery might become an option. And to be aware of that as you're going through those months and years of treatments with non-surgical type procedures, to be aware that that might be something that could become an issue in the future. And I think that that's why it's really good in the situation that we have, where we're working together and we're coming up with plans where our patients, we're not just thinking about next month or next year, we're thinking about 5-10 years down the line.
Well, I think that's amazing that at this practice we give a full plan for after surgery, before surgery, which leads me into how do I prep? We just had the Oscars, we're in Beverly Hills. What are some of your tricks for red carpet ready versus your tricks for I'm prepping for an event in 2 weeks versus I'm getting married next year? What are the plans? What are the different tricks of the trade?
So I think something that's far ahead in advance, like a wedding, doing skin treatments require multiple appointments. It's not a one and done situation. Like microneedling, you need at least 3 treatments. So I think that has to be planned months in advance. For something like Botox and fillers, you need to prepare a month in advance because you want to be able to come back 2 weeks to do a follow-up and touch-up, and then you need another 2 weeks to heal. So that's something you have to take into mind. But something for red carpet ready, I really think facials are an underrated thing. Hydrofacials should be done like a couple days before, and I think it gives you a beautiful glow. And also having a really good skincare regimen is also really important.
I would agree with that. When we're thinking about red carpet ready, I really don't think that's the time to think about a surgical procedure. You really have to plan out the time for the surgical procedure in order to, one, get it done, heal from it, and then get into a position where you're not just healed, but the swelling has gone down and you're getting more to those final results. So when you're thinking about red carpet ready, think about the things that are minimally invasive, things that have very low downtime and give you that pop right before the event.
So if they're interested in doing a laser or Botox and fillers, how far in advance would they need to do that?
At least 4, because most treatments are 4 to 6 weeks apart. So preparing 4 months in advance is a good sweet spot.
Okay. You touched briefly on microneedling. Now there's 3 different things we can do with microneedling, right? You can do salmon sperm, PRP, or now we have exosomes. What's your favorite and why?
You know, I like all 3. I think all 3 have their advantages, and I think people respond to different ones. Sometimes it just takes a little bit of time to figure out which one works best for you. I do like the results we're seeing with the salmon sperm. I think that's very interesting.
Does age play a factor with any of those 3 options?
I think age does come into effect when we're looking at our older patients. You know, when it comes to PRP, I do believe that the older you are, the less effective the PRP is going to be. So in our younger patients, I think PRP is a much better option. Exosomes is better in an older population where we're getting these exosomes off the shelf, and you know, we could control the powerfulness of the strength of the exosomes.
Can you explain to the audience that may not know what exosomes are?
Yes, so exosomes are messenger cells we derive from placenta of younger women. They take it and then they freeze it. And it's 100 times stronger than PRP. It has a lot of growth factors. And we like to use it with procedures like microneedling and Morpheus and other skin treatments like that to help boost the results, because it does help with tissue repair.
Because you're already creating
Microtraumas
Okay.
into the skin. So using that in conjunction with a treatment like that is key.
Yeah, and especially when you're looking at something like a red carpet event, adding something like exosomes or PRP, something that has those types of growth factors to improve the healing and the timing of the healing is very helpful.
We had a new patient that was referred by one of our amazing patients. She called me and said that her, son's getting married in a year. She's not happy. She feels like over the past couple of years, especially with COVID and life happening, that she just feel like she's aged 10 years, and she really wanted to look great for this very special occasion of her son getting married. She knew she had to get surgery. Walk me through, Dr. Feldmar, how is a year enough time if she's getting her eyes done and a facelift, and then how does that go to Emily to keep maintenance so she has the best results for that final day?
Whenever my patients have some type of event that they're trying to plan for, I think the more time, the better. So, ideally a year would be perfect, because that gives me enough time to perform the surgery, give the patients enough time to recover completely. Most of the patients, let's say in a facelift, you might be very comfortable going out in public within a month, but
Right.
if you really want to see the final results of that surgery, you want to give it time for that swelling to go down, for the collagen to completely mature, and really to get the best results of that surgery. And of course, there's always potential complications in surgery. Situation arises from that surgery that needs to be repaired. You have enough time to address that. I always get nervous when people have big events or traveling when they have within, let's say, a month to 3 months
Right.
after surgery. So I think the more time, the better. And it also gives us time after surgery to do those little fine tunings with the aesthetics to really get the ideal results. So yes, if you're thinking about doing a surgery before an event, before traveling, give yourself enough time to really recover and make sure everything goes smoothly and safely.
Let's say this patient we're talking about who had her eyes done and had a lower facelift, a neck lift. At what point are you passing her to Emily? How many months down and why?
I usually give them at least 6 weeks to heal from the initial surgery before I even start thinking about doing some other procedures on them or
Enhancements.
interventions. Yeah, but really from anywhere from 6 weeks to 3 months. What would you say?
I agree.
You concur. And part of aesthetics and part of plastic surgery is that, I refer to both of you as magicians or very high-end tailors, couture tailors, because of the tricks of the trade. And with surgery, there's scarring. How are we getting better with the art of hiding scars? Because this is, arts and science, and combining the both. What are different techniques or tricks that you use to hide scars or make them less visible, because that's the whole.
It's like a fundamental basis of plastic surgery is to try to prevent scarring or camouflage scarring or hide scarring. And it's definitely something that plastic surgeons are continuously always working on, trying to get better at that. I think what we're seeing is, in the past, it was just focused on good skill, meticulous closures, tension-free closures. But now we've gotten so good at that, but it's only gets you so far. And really adding on other adjuvant types of scar therapies, pre-planning with good nutrition, sun exposure, and then obviously the surgical techniques, but then it's the management afterwards. So using different types of lasers to help fade out the scars, using different types of injectables to help flatten scars that develop, doing different types of post-surgical managements like using silicone and other things like that. All of these things really have improved the results after surgery and hiding those scars from view. So I think that that's really, all of these kind of multidisciplinary approaches to managing the scars after surgery has really helped a lot.
Totally. I think following post-procedure instructions are really important, and I can definitely help with lasers. We do have CO2 laser that we do from time to time on surgical scarring, which help improve them a lot, which is really nice to do. How do you feel about silicone patches?
I mean, I love silicone. Almost all my patients have some version of silicone treatment after surgery to help keep those scars as flat as possible without them developing, sort of the complications of scarring that can happen in anyone, such as hypertrophy of the scar. A lot of people think that they develop keloids. That's usually not the case. The keloids are a little bit different, a little bit harder to manage. But regardless of what happens in the post-surgical space, I think it's very important to have a team that's going to be with you, through the whole recovery period, to not just do a great job on the surgery, but also maintain and work on those scars if they should develop after surgery.
The feedback that I get from patients after consults is, I love how honest the providers are here. I love that the providers aren't trying to sell me anything. So it made me think the art of saying no. At what point and what stage are you telling the patient, no, this is not for you? You want to elaborate on that?
So I think a lot of, complaints that I hear is jowling and heavy upper eyelids, and there's a lot we can do with Botox to help those areas, but Botox and fillers can only go so far, and if we're giving you natural results with Botox and fillers and you're still not happy, I think that's the point where we would refer them to Dr. Feldmar to kind of consider surgical options.
Or if they just have so much laxity or so much jowling that
Right. There's
no
so much,
point
yeah.
to do fillers or Botox at that stage. How do we handle that delicately?
Explaining to the patient the limits of Botox and fillers and how far they can go and what kind of results they're looking for. And if I can't provide that for them with Botox and fillers, then maybe having a consult is a great idea just to hear what the options are. I think that's how I would approach it.
I heard that a provider, not in our practice, they called it a liquid facelift with fillers, and they used, I think it was 14 boxes of fillers, $14,000 later. Why would that be a good idea versus surgery?
I don't think that's a good idea. I think overdoing filler can make a patient look older and kind of do the reverse of what you're trying to achieve. Sometimes I think facelifts are better than filler in that aspect. So it doesn't hurt to have a consult and see what your options are.
Beyond patients coming to us
Right.
for our technical skill, I think actually the more important thing that we do or we function as aesthetic providers is giving good advice.
Educating.
And educating and helping guide the patient to what we are comfortable with and what we think is the right thing for them to do. I have no problem saying no to my patients if I don't feel comfortable with what they're requesting and if I don't feel that it matches up with what either I could achieve or if I think it's just outside the realm of what is ethical in any particular situation. So, it's kind of a back and forth between us. I might feel a patient is not a surgical candidate and maybe a better patient for non-surgical interventions, and you see the opposite side. So it's very important in what we do to be able to have a clear vision and a clear advice for our patients that is helpful and helps guide them in the right direction.
And something I really love about this practice is that I'll go in a consultation with Dr. Feldmar, and he'll say, call Emily and Olga. Olga's our facial stylist. See if they can get them in right now. This is not a surgical candidate. And we've been the opposite, where you and Olga call me and say, hey, can Feldmar squeeze somebody in right now? I don't want to inject her. She's a surgical candidate. So I think it's great that we have both of you here, and you guys really work well with each other to educate the patient, to explain to them why you should do this role versus this road. So I just want to touch on a subject real quick, and I know we're going to go into depth about it later, but since the craze right now is Zepbound and the weight loss shots, how does that affect doing Botox and fillers? How does that affect doing surgery? Is it affecting the scar if we do a facelift on a patient and then the patient decides they want to do weight loss because they gained 20 pounds? How does that affect everything?
I always ask patients if they're on injectables, because it's really important to know whether the patient's maintaining their current weight or not, and if they're at their goal weight, and if they can maintain their goal weight.
Right, you hit the nail on the head, yes.
If a patient comes in telling me they're using Zepbound or Ozempic or one of those GLPs, my first question is if they're at their goal weight and if they're maintaining their goal weight more than 6 months. Because doing fillers while someone's trying to find where their sweet spot is, we can overdo it or underdo it, and especially with things like Sculptra, which you can't get rid of, you have to be very conservative and know that the person is at their goal weight, because if they do gain weight, the Sculptra is going to look overdone, and if they lose weight, fillers might stick out and look not good, and we'd have to dissolve. So it's something that you'd have to consider coming in, and we can work with it and treat you conservatively if you're not at your goal weight.
Yeah, I think it's become such a big topic, the
Right.
GLP-1s, and
Everyone's talking about it every day.
and just the number of people that are going on it and are getting the benefits of it.
Right.
And I think that you're having surgery, having a plastic surgery procedure is expensive. It's time consuming. Mm-hmm. It takes you out of work for a period of time. What you don't want to do is do something and then need to redo it or do a touch up or something like that, or at least try to avoid that as much as possible. So if you're just starting out on the PLG1s and you're on a low dose and you're starting to be effective,
Right.
and you're like, I'm feeling great, I want some plastic surgery, my advice to them is like what you said, I want to see you on this PLG1 for at least 6 months, if not a year.
Right.
I want you to get down to a maintenance weight, because then you're going to get a better result of your surgical procedure. You're not going to have to redo it because you lost some weight, you got a tummy tuck, and now you lost more weight, and now that tummy tuck is loose, and you're unhappy about that. So, my goal is to really try to advise my patients, I think it's great that you're on the PLG1s. Let's get you down to your goal weight. Let's get you down to a weight that you're able to maintain, and then address the problems that you have that are surgical with surgery.
So you talked a little bit about Sculptra. Why would you advise someone to do Sculptra, which is a semi-permanent, permanent mm-hmm. filler, as is Radius, versus an HA filler? Is it because they lost weight? Is it because of age? Why? How do you determine if you're using an HA or a permanent filler?
So Sculptra is a biostimulator, and it helps you produce collagen over time. Hyaluronic acid-based fillers are nice because when you do them, you see the results immediately, whereas Sculptra, you'd have to wait like 6 weeks to see the full results. When I would choose to use Sculptra is if a patient's having a lot of hollowing in their cheeks, and it's not something you can really achieve with filler. That's when I would use it. I use it in the hollows of the temple. It looks really beautiful. But again, Sculptra is not a quick fix. It does take time. So if someone's looking for a quick fix, filler is the option for them.
Why would you do sculpture and radius, or how do you determine if you're doing sculpture or radius versus fat grafting? Because that's permanent also, correct?
Yeah, I mean, I think they all have their pluses and minuses, their advantages and disadvantages. I like to use the reversible and absorbable fillers usually in the beginning of the treatments of my patients before they get to a point where they like what they like the volumes that they're
Right.
receiving, and they don't want to keep spending money every few months on redoing that. Then once they get to that point and they're comfortable with that and I like the way it looks, then I would start switching over to more permanent fillers or fat. I really do like the fat because it does bring in living cells, living tissues. It has all the stem cells and other factors that are helpful for rejuvenation. But again, it's a little bit more involved procedure. You can't just take the product off the shelf, although there are some new products coming down the line. So it's finding what's right for the patient in that particular situation and what where they are in their treatment progress.
Is fat grafting considered surgery? So is that why someone would say, you know what, I just want to do filler because I'm so scared of doing surgery? Or how is it a procedure? Explain to us.
Well, in my opinion, fat transfers, it's an invasive procedure.
Okay.
So it is surgery. It's in a more of the minor realm of
Right.
surgeries, but it is still surgery. We do have to go beneath the skin and harvest the fat and process it and then re-inject into different areas.
Okay. Emily, what are your thoughts in filler versus fat in someone's hands? Why do you like filler? Why do you like fat? Are they equal to you?
It's a hard question.
It's a hard question.
Well, I think, you
That's an
obviously
easy
have
answer.
to. Okay, you
Keep
answer it.
rolling. No, keep
You answer
rolling.
it.
I love this. Go ahead.
Well, with fat, you obviously have to harvest the fat. So they have to have a good amount of fat to be able to do that. Whereas radius or an HA filler is off the shelf, so you can quickly do it. I think it's less of a downtime because you're not making incisions and because you're not doing the whole harvesting. So it's quicker and it does look beautiful in the hands. But if you want longer lasting results, I feel like fat grafting may be the option, although sometimes it's not.
Yeah, I mean, I think that, there's pluses and minuses about all these different procedures. Using radius is great. It's off the shelf. It's minimally invasive in the sense that I don't have to harvest fat, right, and process it. It could be less financially of a burden to do something like that. But you're not getting some of the benefits that you do with the fat. And because fat is living cells, the fat that we're harvesting has stem cells and other cofactors that are involved in rejuvenation. So not only are you getting the volume that you're replacing with the fillers, but you're also getting the rejuvenating effect of the fat. So I do think that, both are great. In some patients, one might be a better option than the other. For example, not a good donor site,
Right.
someone that doesn't have the fat to even take. Or maybe their age just kind of ages them out of using fat. As we get older, our fat is not as great to do fat transfers. Because fat is living tissue, some percentage of that fat is not going to survive. It'll just be reabsorbed. But that fat that does survive tends to live forever. However, there is the other side of fat, is that because it is living tissue, you could gain and lose weight with the fat too. So it can potentially change in size over time. Although I don't really see that very much when we put it in the hands.
Okay.
But that is a theoretical possibility.
I didn't even think about that. Wait, that's really good. So if you put fat in my face and I gain weight, my face is going to be the first area to get fatter?
Well, I'm not saying that it's necessarily the first area
Okay.
that gets fatter, but if we tend to take it from areas that are the first to kind of increase or decrease in size, yes, it's going to do the same wherever you move it to. So if you put fat in your face and you do gain a lot of weight, that fat in your face can grow.
Learned something new today.
And the opposite could be the same. If you do a fat transfer and you love the results and then you end up going on a PLG-1
Right.
and you lose 30 pounds, that fat that you transferred might just kind of disappear, shrink.
But if you did filler and lost weight, it wouldn't shrink.
The filler would not shrink
Okay.
necessarily.
I think people were asking that as well. Thank you for joining us today. It was lovely having both of you. I appreciate your time.
Thank you, Marcy.
Yay!